కరోనా లక్షణాలు కనిపించినంత మాత్రాన భయపడాల్సిన అవసరం లేదంటున్నారు డాక్టర్లు. సాచురేషన్ పాయింట్ 94% చేరినప్పటికీ డేంజర్ లేదంటున్నారు ఎయిమ్స్ డైరెక్టర్ రణదీప్ గులేరియా. నారాయణ హెల్త్ చైర్మన్ దేవి శెట్టి, మేదాంత హాస్పిటల్స్ చైర్మన్ నరేష్ టెహ్రాన్ వారు మాట్లాడుతున్నారు. లైవ్ చూద్దాం.
Should be done, and any patient who needs it should get it. So wastage will only lead to depriving some people of this oxygen, which you should be, as individuals, as citizens, have a collective responsibility that we do not want to get into that stage where we feel responsible for being selfish in wasting something and depriving somebody else. So having given you that, there is good hope, but masking, of course, is your first duty. Wear it, distance yourself, and hand hygiene is every citizen's responsibility and the first line of defense and the most effective way of preventing the virus from spreading. So the bed situation in India, a lot of expansion of capacity has been done in the last year. We are also more capacities to be added. But what I would like to communicate is, and appeal to people is, don't rush to the hospital just because you have tested positive. You will be taken care of or will be given beds if everybody participates responsibly in this and the doctor prescribes that, yes, it's time to bring you into the hospital. Same advice we are giving to all our doctors also, to take care of patients properly. When they need it, only then advise that they should come into the hospital. There is no such thing as preventive hospitalization. We should not do that. There is always a limited capacity, but we will go. And you will appreciate that for the over last 15 months, the medical community, the health line workers, the frontline workers, we are all standing, fighting together this whole unfortunate event that has happened. And we need your help in reducing the burden, and we can do a much better job for you. So with that, thank you for listening to my communication, and I'll hand it over to Dr. Guleria, who will add to whatever things that needs to be done in addition and give an overview of what the population, potential patients and doctors and hospitals need to do. Thank you for your attention, and over to Dr. Guleria, please.
Thank you, sir. Thank you, Dr. Trehan. And I'll be addressing a few things which I think are important for the public to understand as far as the current situation in the pandemic is concerned. And I'll take it from where Dr. Trehan left off. The first, of course, most important thing to understand is that in COVID-19, and we have now enough data, that more than 85% of people will recover without any really specific treatment in the form of remdesivir, steroids, or any other drugs that we are talking about. Most of them will have features which will be like a common cold, body aches, fever, sore throat. Some may have gastritis, and over a period of 5 to 7 days, they will recover with just symptomatic treatment, which means just taking paracetamol, keeping yourself hydrated, doing your regular exercise, taking your vitamins, and just being positive about your health. It's only 15% of people who may go on to what we call moderate disease, where your oxygen saturation may fall, or you may have high-grade fever, and there may be markers to suggest ongoing inflammation. Now, it's only in that percentage of people who have other features to suggest that the disease has progressed that we need to give treatment in the form of remdesivir, steroids, anticoagulants, and sometimes we also give convalescent plasma. So it's important for everyone to understand that most of us who are either in home isolation or even in the hospital because of panic don't really need any specific treatment. Like you treat a simple cold, you can get away with treating COVID in majority of people with just taking paracetamol, keeping yourself well hydrated. It's only a small percentage which will require drugs like remdesivir, and there is no data which suggests that remdesivir taken in mild disease will save lives or will have any benefit. The data for remdesivir does not show that it actually decreases mortality. It only has been shown to decrease hospital stay. And the large study done by WHO, the recovery trial, was a negative study. It did not show any role of remdesivir. Therefore, don't consider this to be a magic bullet. It is something that we need to keep in mind. So that is the first message that I would like to give, that majority of people don't need to panic. They can home isolate themselves. And as Dr. Devi Shetty said, monitor yourself at home, keep yourself well hydrated, monitor your saturation, and consult your doctor if you have any worry. But you will become all right staying at home, and you will not need to come to the hospital. Very few will actually need to come to the hospital. By rushing to the hospital, you are creating more chaos, and you're not actually benefiting yourself, and you're actually denying a bed to a fellow citizen who may need it and may not be able to get it because of unnecessary hospitalization for people who don't need to be in hospital. The second thing that I would like to talk of is regarding oxygen. Now, there is a lot of issue as far as oxygen is concerned. I do agree, and this is very important for those who have oxygen or need oxygen. Oxygen is a treatment. It's like a drug. And therefore, it's very, very important for us to understand that one of the treatment for COVID-19 is to give oxygen if you need it. And in many lung diseases, when you have pneumonia, when you have chronic lung disease, when your saturation falls, oxygen is a treatment that is given sometimes for a short duration, but sometimes people are on long-term oxygen therapy if their lungs are bad because of a chronic lung disease. Now, an important issue here is that taking oxygen intermittently. Your saturation is all right, but you say, okay, let me take oxygen for half an hour after my meals, or if I take oxygen for a few hours in the day, my saturation goes up and I'm feeling better, and I should therefore continue oxygen, is actually a waste of oxygen. There is no data to show that this will be of any help to you, and therefore this is something that you should not do. Many patients have started keeping oxygen cylinders at home and have started taking it for half an hour, 2 hours. That itself is more harmful and is actually again denying oxygen to people who actually need it. The third important thing to remember as far as oxygen is concerned is oxygen is carried in our blood, and we look at what is the oxygen which is carried in the blood by looking at the oxygen saturation. But if your saturation is 92, 93, or your saturation is 98, 99, the actual oxygen in the blood is not very different, because the oxygen dissociation curve is what we call a sigmoid curve. And after you reach a saturation of 90, it is actually flat. So you don't really get too much of oxygen in your blood, even if you go from 92 to 98. Therefore, in those individuals who are having an oxygen saturation of 93, 94, there is no need are not taking care about crowds developing. You may feel that all your friends, and this happens to residents, it happens to your friends, your colleagues, that all my friends are all right, I know them, so they are not infected, so we can all sit together and have a cup of tea or have a meal together. You may have many who may be asymptomatic. And if one of them has the infection, we are now seeing a strain which is very infectious. It will infect majority, almost all of them who are sitting together and having your cup of tea or having a meal together. So please don't have crowds. Eat your meals separately, have your tea separately, communicate through your telephones, your other apps, but don't really sit together, because this is not the time to do so. So I would just appeal to everyone, and this appeal is actually from all of us, from the doctor community, that we have to bring our cases down if we really need to really work aggressively in decreasing the load in the hospital, saving lives, and decreasing the stress that healthcare workers are currently going through because of the increasing pressure that they're seeing in the hospital. For that, every citizen should come forward and follow COVID appropriate behavior. Please wear your mask, maintain physical distancing. Please don't form crowds. Avoid others from forming crowds. Stay indoors if you don't have to go out, if it's not essential. If we do that for the next few weeks, our cases will come down, the hospital strain will come down, and we will come out of this pandemic once again, as we have done last year. So my appeal to all of you is, please mask up. If we all get together, we can come through this very, very successfully and in a very short time. So, and finally, I'd like to thank my colleagues, Dr. Naresh Trehan and Dr. Devi Shetty, for being part of this conference that we had. And again, I'd like to appeal to everyone to wear their mask and maintain physical distancing. Thank you very much.